like to introduce Gina Madison, who's executive director and board member of the Liver Education Advocates. She leads initiatives to raise awareness and education on liver health and metabolic liver disease. She has 2 decades of experience in marketing and leadership. Like, holy crap, Gina, did you start when you were like 5 years old or what? Anyway, sorry, that was off script. Yes, and really instrumental in driving impactful programs and outreach since 2019. Welcome, Gina, and take it away.
Thank you. Well, really grateful to be here today, along with some patient superstars, Bruce Dimmig and Kerry Sivia. And today, what we want to really just discuss is three kind of key things as we think about, the patient aspect as it relates to MASLD and MASH. And we really want to hone in on patient-centered care, early detection and management, and communication and stigma. We want to make this a conversation. You'll see that we don't have slides because we really wanted this to be a conversation between the three of us, but also want to just open up the floor as well throughout, through the function of raising your hands or however we're going to work that, as people have questions throughout. And we're going to also end just talking a little bit about patient resources and education. And also, we want to hear from you on what can us as patient advocates do to better help providers as you're seeing patients. So before I get into conversation with Kerry and Bruce here, I just want to share a little bit about my background. So I kind of stepped into this by chance, but I really do believe this is my life purpose, the work that we're doing. So my father, Tony Vigliotti, who some of you may know, actually had a liver transplant in March of 2018. And his journey is really, kind of the impetus of why he started our organization. 6 months after his transplant, he started, well, it was Nash Knowledge at the time. It is now Liver Education Advocates. But his journey started, he was talking about type 2 diabetes. He was type 2 diabetic pretty much his entire adult life, living with type 2 diabetes. And he would see his PCP every 6 months for his diabetes. And at one of those appointments, he was told, "Oh, you have fatty liver. Eat better, lose weight." Well, he's a big Italian guy. He's probably been told that every doctor's appointment since he was 5 years old. So he thought nothing of it and continued to be concerned about his diabetes. So he would go every 6 months for 9 years. So that's 18 doctor's appointments that he would see his PCP. Sometimes the fatty liver would be mentioned. Sometimes it would not be mentioned. Well, you fast forward 9 years later, 18 doctor's appointments later, and he's suddenly told he has cirrhosis of the liver. My dad never drank, maybe like a glass of champagne if he was at a wedding one year, just never like got into really drinking alcohol. So they actually thought that they had called the wrong patient because he had never been told that he could be potentially at risk of getting cirrhosis because of this fatty liver. So that's really why he started our organization. And we're really focused on raising awareness and providing education to help others prevent the path that my dad went down. So I just like to share that background because although I'm not a patient myself, I was a caregiver and just have that deep family connection. But we have two wonderful patients here with us today, Bruce and Kerry. So Bruce and Kerry, I just want to give each of you maybe just spend a brief minute or so just kind of sharing your journey as well, and then maybe we can dig into some of the specifics around those areas that I highlighted.
Kerry, ladies first.
So I am a MASLD MASH patient. I was diagnosed in 2021 at the age of 36, and I was one of the patients who fell into the obesity category. I initially weighed 314 pounds at the time of my diagnosis. I My biggest factor is probably the obesity, but I also have autoimmune hepatitis, primary biliary cholangitis, and those three things resulted in liver cirrhosis. So for me, that's how I got to be here. But I will say just right off the bat, so we can hear a success, that I have lost 110 pounds since then. And that's because of the multidisciplinary care that I've received.
Great. Thanks, Kerry. Bruce?
Well, for me, I'm currently staged F3, F4. I'm just on the starting point of cirrhosis. My journey started about 12 years ago, and I've had every diagnosis from nothing to fatty liver to NAFLD to NASH to some couple of rare diseases. And I think too, one of the things was I was told a while ago about metabolic syndrome, but I didn't really understand what it was or what the ramifications could be from that. So I really think patients need to know the ramifications of what that is. But uh, I've also had about every test that there is in the book. So if anybody has any questions on any of the tests, I can tell you the patient perspective of it.
Thanks, Bruce. So I think obviously the folks that are here today, the PCPs that are joining, obviously have a deep interest in this. But as we think about just kind of that early detection and management, and we just talked about all these different tests, could each of you or whomever feels the most led just talk a little bit about, why it's really important identifying these early signs and not just kind of brushing them off. Actually, Kerry, maybe you could take this because I know you kind of your journey, you had some of that going on initially in your journey.
I did. My primary care provider was really good about knowing about the liver. So I came to her one day back in January of 2021, and I had really swollen ankles. And I had tried for a few months to reduce my sodium intake and see what that did. I had had swollen ankles in the past before, so I didn't think that much of it. And I should say that medically, in my early 20s, I also had swollen ankles, and they couldn't find any cause for that. So I was kind of like, oh, it's probably nothing. And as it turns out, even back in my early 20s, it was probably liver disease developing. Just I was not someone who had alcohol use disorder. I was not someone who even drank socially, really. So I was missed. Um, but my primary care doctor, the second time around, when I came to her with swollen ankles, she said, those are pretty swollen, and let's see if we can figure out what's going on. So she did blood tests. She ran the um, complete blood cell count, and she also did the complete metabolic panel. The complete metabolic panel that she used did include my liver enzymes. My liver enzymes were off the charts. My alkaline phosphatase was 486. The normal range is less than 117. My ALT was 111, and the normal range is anything under 64. And my AST was 114, and the normal range for that is anything under 37. So some of my tests were about quadruple what they should have been. And she's like, well, something's going on. I want you to go to the emergency room. So she sent me through these channels, but luckily she knew enough to know that something was going on and didn't just say, hey, this is probably just a fluke, or that it was something that could be very serious. And thanks to that caution and that knowledge of the liver and what the normal steps should be, that's how I got into gastroenterology care, and gastroenterology care then pushed me into hepatology care, which is how I've gotten to be successfully treated.
I've kind of got the almost an opposite experience. Uh, I was seeing a PCP for many years, and I started keeping track of all my blood work. And if going all the way back to 2004, so I mean, between 2004 and 2012, there was, had no I won't say no interaction, but no knowledge of what the test results meant. And once I got those into a spreadsheet and started looking, my ALT, AST were higher than normal for most of that time. So if my PCP had been aware of what the ramification, yeah, my encephalopathy is bad tonight, what the ramifications of elevated ALT, AST were, I may have been able to catch the disease 10 years earlier than what they did.
Well, thank you both, because I think, you're having those different stories, and we see that patients are individuals. And I think that's something that's so important too. I forget, one of our patient advocates says it all the time. If you've seen one patient, you've seen one patient, because everybody's story and journey is different. But at the same time, right, there are these signs, right? The early warning signs. There are ways, to really be able to diagnose early. So as we talk about this also, we like to talk a lot about patient-centered care. So Bruce, sorry, but I'm going to keep calling on Kerry, females first, and then you can follow up behind her. But Kerry, can you just talk a little bit about the importance of treating patients as individuals and not just numbers? And again, I just want to like stress and reinforce that we're not saying that anybody on this call is not treating patients as individuals. Obviously, if you're all here, you deeply care, but I think it's just something that we do face sometimes, as patients, when we go to see different providers.
Sure. So I think it's probably an easy pattern to slip into where you look at the diagnostic criteria and you're like, the patient doesn't present that way. But Bruce and I are both cases of patients who didn't have the typical criteria, which kind of goes to show you that with liver disease, especially, there really is no typical criteria. So patient-centered care is absolutely vital in this. And we're not asking you to learn all of this overnight, but we are asking you to kind of dial in more on the liver. And I'm really glad that you guys are all here because that means that you're doing that. But patient-centered care also is empathy. It's also listening to the patient, what the patient's lifestyle might be like. And it's also trying to reduce stigma in the exam room of making the patient feel secure enough to talk to you about things that are really sometimes very difficult topics to talk about, especially if they have any type of substance abuse struggles. Um, that's a very difficult thing for a lot of patients to talk about, but we are all trying as patients to open those doors. I, for one, did not have any type of alcohol use struggle or any type of alcohol use disability, but that doesn't mean that I didn't know someone who did. And I see those struggles. I've become friends with people who've had those struggles through advocating in common with liver disease. And it's really important to just listen to the patient. That's probably the best thing that you can do is listen to the patient and not say, oh, this is anxiety or, oh, lose 50 pounds. And by the way, if you are going to lose, give that advice of lose 10% of your body weight or lose 50 pounds or whatever that is. That sometimes is medically necessary for patients to hear, but please make sure that you have resources for that, such as diet and nutrition care.
Yeah. To add on to what you're saying about listening to the patient, I think one of the things that, and again, like Kerry said, we're not throwing any darts at anybody in the audience, but in the past, I know Kerry probably has, where the patient runs into the doctor, where you go in, you say, well, gee, my knee hurts, or this hurts, or I have this symptom, or I have that symptom. You know, listen to that and don't dismiss it and say, well, that's just, women problems. That's just a man problem. It's just your age. Listen to the actual con concern and internalize it and talk to the patient about it. And like Harry said too, don't make any biased or stigmatizing thought about that. And one of the other things too about is understanding the comorbidities that a patient can have. Like we've talked about in the slides and so forth. Do they have high cholesterol, high blood pressure? All those kind of things. Those also. And going back to what Kerry said on empathy, I think another. Sorry again, my cephalopathy. One thing that I think that goes along with empathy and what empathy leads to is trust. The doctor needs to trust the patient and the patient needs to trust the doctor. It's a two-way street. So I think that's just important too, is to be able to trust each other.
And I just want to throw this out there also. One challenging but also simple way to have patient-centric care is to use patient-centric person-first language. Um, we are patients with MASLD or people with MASLD, but we are not MASLD patients.
Yep.
Yeah. That's great, Karen. I was going to just talk about a little bit about, the patient first, people first liver charter and, just the language that is used and also the stigma that so often still exists around liver care and it's or liver disease. And sadly, we hear stories all the time when we are out, like liver education advocates, we are constantly out in the public setting. We go to health fairs and community events, and so many people that we talk to say that, they or someone they know are living with liver disease. And a lot of times, the first thing that their doctor asks is, how much do you drink? And again, not even, and I'm not, I hope no one takes this the wrong way that I'm stigmatizing or bashing, people with alcohol-associated liver disease. I actually come from a background, I'm in recovery myself, so I really understand the struggles of all of that. But like that should not be the first thing, so that the people first language and treating patients as individuals is so important. And I heard at one of the talks at the liver meeting, at the ASLD liver meeting that I heard somebody reference recently was that we are all patients in some way or another. So as providers, sometimes if you can just kind of step back and think about how you are also a patient, maybe not for this specific disease, but in some way or another, and think about how you would like to be treated, how you would like your doctor to treat you as well, I think is a great lens to kind of to approach as well.
Well said.
So yeah, so what else would you guys, we've talked about the patient-centered care, the importance of early detection as well. And I think you both talked about like spotting the trends and how it's important to look at your patients as individual. But what else would you like to make sure if you had one more thing, because I'm watching the clock as well. So if you each have like one or two more key points that you would like to get across, because then I want to just hit briefly on patient resources and education, and then also open it up for questions on what we as patient advocates can do to help providers.
Kerry, go ahead.
Well, I think this kind of sounds like it leads in a little bit to what we might have coming up the path in just a couple minutes. Having those resources is absolutely vital. The the
Yeah.
advice that I got initially from gastroenterology was not bad advice, but it was not essentially useful. It was a handout and to you lose 10% of your body weight, and it talked about like the Mediterranean diet, which is better than nothing at all. But working with dietitians in your community or nutritionists actually is I think, a more useful strategy. Having someone who can give you resources for different types of food that you like, or different types of cultural foods that are also Mediterranean diet adjacent, are really good resources. And that actually helps your patients to have a better care experience as well. Also, reminding them that there are small resources available like Map My Run, phone apps, that will help you to track what you're eating, help you to maintain accountability. Those are all things that you can talk to your patients about as well that make it easier. So it's not just like go lose 10% of your body weight. Good luck. God bless. See you in 6 months.
I think a couple of things that I would like to point out are one, utilize the patient portal. Talk to the patient. Let them know that there is the patient portal, and what documents, what resources are available through the patient portal. Because again, as we all understand, the PCP, you're pulled in 3 million different directions. So the more that you can give the patient the resources to go to, and to kind of like give Gina a little shout out here, know the patient advocacy organizations in your area, or nationally or internationally, and have those resources for the patients so that they can go and do some of the work themselves. Again, kind of what Kerry said is, this will probably be stepping on somebody's toes later, but the patient needs to be prepared as well. So if you give the patient the resources to be prepared, then they can come in and you can have a better appointment and better visit with the patient.
Yeah. And I would like to just kind of piggyback off what Bruce said as well. There's several different patient advocacy organizations. Of course, I'm going to be biased here and plug my own organization. However, I will say at Liver Education Advocates, our website is liveradvocates.org, and we have a complete library of tools and resources, and they're used in numerous clinics, PCPs, specialists across the nation. And we have different, we have a fatty liver roadmap. We have PCOS and fatty liver disease, diabetes. We have a lot of different tools and resources, and we highly encourage providers to use these with your patients. You can print out the PDFs from our website directly. We also always ship materials to people for free at no cost if they want them, because my dad, again, to go back to his story and why our organization exists, is this is all information that he wished he would have had during his journey. And it's also things that based on questions or conversations we have with people and patients that we see a gap and we create a piece of material for that.
Gina,
Yes.
I'd just like to add one more thing. Now I know there's a lot probably independent PCPs, but if you're part of a larger practice or a hospital system, if your hospital system or whatever has a support group system, I think that's another resource for patients that to give to them.
Yep. Absolutely. All right. And I think, okay, yes.
Yeah, listen, really great insights and really great inspiration, guys. So the one question that I would have for you, and recognizing our time is short, but I got to get this one in, is that one of the things that I find as a primary care practitioner is how to strike that balance about saying to somebody, geez, you've got some early liver issues, probably related to, the weight and the diabetes, and I'm giving a lot of multiple messages about lifestyle. So how much do I sort of say, downplay the significance versus going on the other side to say, look, we've got to get on top of this because the natural history of this is it could lead to cirrhosis and liver transplant. So I'm struggling often with my patients do I have the kid glove approach and I'm your buddy to help, or do you know where this is going? I don't know. Any insights?
Yeah, if you don't mind,
Yes.
one. And again, like we've been saying, like Kerry said, every patient is different. So I think I hate to tell you this, but I think you have to deal with it on a patient by patient basis. You need to be able to read the room, so to speak. Can I tell the patient the news, or can't I? And then go from that. Now, for me personally, I want the truth. You know, you know, tell me so I can make an informed decision. Again, like you say, probably some patients probably can't handle that. And also, if you're telling me the truth, like with my hepatologist, if he doesn't know something, he tells me. It's like, hey, I don't know. We can find this out. We can do this together.
So I would say as a patient, I would want to know more information versus less. Um, I know that there's a lot of information being thrown at patients oftentimes, especially in those initial exams where you first start to see the signs of liver disease. But I think that there are ways that you can provide things like handouts that can kind of reinforce and they can go back to those things. Hopefully they don't just like walk out and toss them, but also put it in their chart for them so that they can go back and find those things as well. There's a way to do attachments through the messages. That way they can always go back and have it. And I, as a patient, would much rather have more information than less. I think
Absolutely.
less information creates the opportunity for missed opportunities that you may not have again
Yeah.
anytime soon.
Yeah. Guys, really great wisdom. Gina, thank you for your leadership. Bruce and Kerry, thanks for
Thank
telling
you.
the patient side of the story, and again, really appreciate the offerings today.